A secondary 5 student on a class trip to the Chinese city of Hangzhou. A 16-year-old boy struggling with troubles at home. A 12-year-old boy feeling crushed by pressure to succeed at school. All three were young Hong Kong people who made a tragic decision to take their own lives at a time when the city faces an alarming rise in youth suicides. In the first 8 months of 2025, Hong Kong's Education Bureau recorded 23 suspected suicide cases among students. In 2024, the suicide rate among city residents aged 15 to 24 was more than 34% higher than it was in 2019, according to data compiled by the Hong Kong Jockey Club Centre for Suicide Research and Prevention. Zoom out a bit and a startling trend begins to emerge. The number of suicide cases in the city has continued to trend upwards despite efforts to reach at-risk youth.
How come our students choose, they take their life at such a young age? Is there anything we can do more?
Paul Yip and his organization have spent more than 20 years trying to understand the causes of Hong Kong student suicide problem.
There are two major factors that has come in. One is the school, and then the other is the family.
Yip's findings are in line with previous research into the issue, which has also become a major concern for city authorities. In 2017, the Hong Kong government hosted a forum on youth suicide that offered students a chance to offer their own perspectives on the roots of the problem.
各位早晨，我係小三學生，我今日想話俾大家聽，我哋啲學生點樣生活。咁大家明唔明白咩壓力？我每一朝都唔夠瞓，日日都好攰。成日都要評估呢樣評估嗰樣，點解要評估咁多嘢呢？科科都要評，個個都唔開心。返學校好似俾石頭砸住我咁樣咯，係咁砸，點解要咁對我哋呢？
To understand how academic pressures affect the mental health of young Hong Kongers, look at these findings from the Hong Kong Suicide Press database. Hong Kong's education system is split into 3 stages: primary school, secondary school, and tertiary education. At age 7, when students are enrolled in primary school, the youth suicide rate is 1.16 according to 2025 estimates. At age 12, when students move on to secondary school, the suicide rate increases to 7.69. At ages 15 to 19, as students prepare for Hong Kong's intense university entrance exams, and later as they start their first year in college, the suicide rate reaches 13.5. Suicide is a complex issue. Correlation and causation are difficult to parse, and there could be other factors behind the rising rate, such as relationships, family troubles, and societal issues. But there are clear signs that as academic pressure rises, so do suicide rates. This is why experts often say it's important to reach out to students who are struggling with the pressures of academic and social life and offer support and understanding.
It's okay not to be okay. So everyone had this feeling. I think our life is still full of challenges, but it's full of excitement as well.
Other data points to societal reasons as the cause of several past spikes in the city's youth suicide rate. The issue first reached crisis levels in 2016 after 32 university students died by suicide in a single year. Anecdotal evidence gathered by the Hong Kong Suicide Press database found that the mental health of university-age students in Hong Kong plummeted around 2015 and 2016. The time was 1 to 2 years after the end of Hong Kong's youth-led umbrella movement. The protests calling for universal suffrage failed to gain traction among those in power in Hong Kong. Interviews in the years that followed found that many Hong Kong youth felt a sense of helplessness. Zhang Yufei, the former chairperson of the Hong Kong Liberal Studies Teachers Association, spoke about the problem that year with German broadcaster Deutsche Welle. Jump ahead a few years, and a second spike occurred in 2023 as students returned to school following 2 years of Hong Kong's strict coronavirus restrictions.
其實疫情對細路嚟講都係一個好難嘅一關。嗰2年嚟，佢哋喺屋企上堂啦，佢哋接觸唔到群體咧。其實青少年人最需要就係返學校，同唔同嘅青年一齊相處。小學升中學啦，去到中3，佢哋一個同學仔都唔識。
This time, Hong Kong's Education Bureau was better prepared. During the 2023-24 school year, education officials rolled out a 3-tier system that aimed to reduce the number of youth suicides. Under the system, parents and teachers were educated about the warning signs of youth mental health issues and taught how to offer needed support. The system also established an off-campus support network provided by NGOs that established clear guidelines for school principals about when to refer a student to professionals at the Hospital Authority's psychiatric services. While the system's guidelines remain in effect, their impact remains elusive.
I think only 25% of the young people, who kill themselves, who are known to the system. So there's another 75% who are not known to the system. So if we only rely on this 3-tier system, to deal with the suicide prevention, it might not be that effective.
精神健康其實唔等於自殺嘅，唔係一定因為你有精神問題，所以你去選擇自殺啦。我哋覺得自殺同埋精神疾病都係一個結果啦。咁但係我哋正正就係去揾一啲原因，點解會導致到呢啲結果咁樣。
In September 2025, Young Samaritans hosted a forum that brought together young people, parents, and educators. One important takeaway was the importance of parenting styles that offer support and understanding instead of criticism and pressure.
係溝通係雙方㗎嘛，但係去到意見分歧嘅時候，就好多時候發生嘅就係家長黑面啊、閂埋房門等拒絕正面討論到情況，而呢個就會導致青年人唔想再同啲人溝通啦。
Hong Kong youth say they need to feel like they're not alone when facing a crisis. Parents can help, but students should also be able to turn to counselors or friends.
我當時我自己就已經好幸運，有一個輔導員可以幫到我啦。咁就佢會搞啲唔同嘅 program 俾我去即係踏出第一步啦，去令自己覺得我係一個有才華嘅人啦。咁但係就如果嗰一刻係冇一個輔導員喺我身邊嘅話，咁我最想得到嘅係咩咧？其實可能就係朋友啦，即係可能係學校會唔會幫到我令到我更加識去交朋友咧，或者學校會唔會令到我更加有歸屬感咧，令到覺得喺學校一個安全可以俾我 explore 自己嘅地方咧咁。
因為我身邊有朋友佢有呢一個精神健康嘅問題啦，然後佢係嘗試即係想結束自己嘅生命，咁我就會覺得原來呢一樣嘢，當呢個新聞見到嘅時候，同埋自己身邊嘅人真係接觸到嘅時候係會有分別。我當時係首先我係尊重同包容啦，同埋係默默咁樣聆聽，因為好多時我哋做到嘅嘢就係陪伴佢哋，咁等佢哋知道其實佢自己唔係得一個人。